Hello, I'm Veda Piers. I work for the Lung Association. This is the 12th annual Air Quality Workshop, and I'm here with Meghan Winters, who is a professor at Simon Fraser University, and we're here to talk about active transportation. And tell me what that means.
Sure. So when most people think about active transportation, they think it's about walking and cycling, and those are certainly the most common forms of active transportation. But there's a lot of other human-powered ways of getting around. We shouldn't underestimate skateboards, rollerblades, and in a country like Canada, of course, we have to think about people who are skating to work along maybe the Gatineau River or cross-country skiing. One of the big sort of debates amongst people who do this is public transportation active transportation or not? And we would say it was. This is an example of work that we've been doing here in Vancouver in community-based studies where we strap GPS and accelerometry on people to figure out how much physical activity are they actually getting from their transit trips, because you know that when people take transit, you see them run for the bus, right? And so we're finding that people on an average transit trip get about 9 minutes of physical activity when they're kids, about 5 when they're adults. Other studies have quantified, you know, in a given day, people are getting 12 to 20 minutes of physical activity. So we would say that public transit trips count as active transit as well.
Wow. So what are the links between active transportation and health based on the available evidence?
Right. So we've recently come out with the benefit here in Vancouver that the My Health, My Community survey has just been completed with 28,000 local residents. And so it's a cross-sectional study where we can look at people who actively commute and what are the health outcomes for them. Being an active commuter decreases your odds of overweight or obesity. And we also see various health benefits related to meeting daily physical activity recommendations, overall health behaviors, and a likelihood of reporting good health. There's a number of different pathways that we see when we look at the links between active transportation and health. And the strongest evidence would be in the realm of physical activity benefits, as well as facing that there is injury risks associated with active transportation modes and the risk of some exposure to air pollution. And these have consequential health outcomes. There's other pathways that have been less studied, but maybe of interest to particular stakeholders. So social benefits, less time commuting means you've got more time with your family or to be involved in your communities. Environmental and transportation-related benefits, and other economic benefits. Active transportation or bikes are good for business, less absenteeism, or addressing hidden costs of transportation. So there's a whole host of possible benefits. The studies that typically look at the overall health benefits and risks of active transportation typically consider physical activity, injury risk, and air pollution. And they've been done across a variety of contexts, different modeling approaches. Most of these have been done in Europe and the UK, not many of them at all in North America yet. But what we see is that on the whole, the benefits of active transportation far outweigh the risks. So 10-to-1 ratios up to 100-to-1 ratios. So the physical activity benefits are real drivers of the net effect of active transportation.
So there are benefits. Are there barriers?
Yeah, there's absolutely barriers. So if you, people will often talk about safety is the main barrier to active transportation. These are vulnerable road users, being a pedestrian or cyclist, and we do see that there's increased risk for injury when you're cycling and walking as compared to driving. That is true. So the safety barriers that people see are perceived and also real. There's sort of 3 main approaches that we can do to promote active transportation and get around these real and perceived safety barriers. The first sort of broad category would be about infrastructure, making sure there's a foundation so that people can get around in safer ways, that they feel like there's space for them on the roads. And that may be building dedicated cycling lanes or other types of cycling facilities that there's evidence now of what's safe. In terms of walking, which we should not overlook, you know, it is important to have sidewalks or safe places to walk. But even within that, more amenities for pedestrians. So when you speak to people with kids or older adults, the importance of public bathrooms. We can't just rely on the coffee shops being available to when you need to use a bathroom, or benches for people who might need to stop and rest on their routes as well. So as we have an aging society, we need to consider sort of the broader needs of pedestrians as well. Maybe the second category would be about encouragement and promotion. So There's a trend that we've seen across cities, across countries, of safety in numbers. The more people who you see safely walking and cycling, the higher rates of walking and cycling, the less risk of fatalities and injuries. And this is held in ecological studies and also looking in time series over time. So we need to get people out there walking and cycling, and how are we going to do that? There's examples, there's a lot of promotional programs, whether it's active travel to school, education training programs for kids to get them started cycling early, promotional events like the Heart and Stroke Foundation's Roll and Stroll event that they did in Edgemont Village, and then real exemplars from other countries around cyclovias, so places where they close the street down for automobiles but keep it open for walking, cycling, and families to come out. In Bogota, Colombia, where ciclovias really started, they've got 72 events a year, and over 1 million people come out to each and every one of those, especially middle and low-income people. So it's really serving the people who need it most for getting around and making walking and cycling a more normal thing to do. The other sort of third category would be about technology approaches. There's been talked at today's meeting about vehicle improvements and fuel emissions, but technology here, I'm thinking about mobility solutions. So giving people choices out that how they're going to get around. They may take different modes in the morning versus the evening, depending on the weather, where they need to go, the time that they have. So in terms of active transportation, that means things like public bike shares. It may mean things like car shares, car-to-goes, where people can make one of their legs of their trip. But we should also think about the low-tech solutions here. So some people talk about rolling suitcases as being a great solution, to meaning that now we don't need taxis. People can roll right down to the SkyTrain and hop on it and get to the airport. But I like to emphasize the importance of the granny cart. So all of a sudden we don't need to take our car with us to go for groceries. Instead, load it up and you can walk on home again.
Yeah, okay. Good ideas, but what do you do on a day like today when it's raining really hard? Are there fewer people who are willing to take these alternative modes of transportation?
Absolutely. I think it's important to emphasize that people are multimodal. They make choices on a given day, and so that's why we need choices and solutions across in cities. So, for instance, today in the pouring rain, I took the bus here instead of biking. It took double the time, no doubt, but I make a solution on the run, and I have choices because I live in a city and in a location where I could choose between the bus, the car share, or the bicycle.
But climate is obviously a consideration.
Climate is obviously a consideration, and that's why I want to emphasize that, I'm always surprised when I go to Ottawa and somebody skated into the meeting that I'm coming to. So people make adjustments to the environments they live in. We also see really high rates of cycling in some of the colder climates. So the Northern European countries, in the Yukon, we also see really high, in Whitehorse, there's actually very high rates of cycling. So there are wheels and technologies and gear that will make it safer and more possible to ride in all conditions if you make that choice.
So it takes some investigation on a person's part to
Absolutely,
find these
and
things?
there's no problem with people choosing different modes at different times. So I think it's just about, is there a day a week where you could take a different travel mode, and all of a sudden you realize it might be feasible and possible. Maybe a couple of years from then you may decide that you're willing to do that year-round. Or that if you're in the case of Sarah Henderson, electric bike makes all the difference for you getting the distance you need to go.
Well, thank you. Lots of things to think about.
Thank you.